Establishing a monitoring base and an evidence base across the social recovery space is very important, and it's something that needs to be established and set up, I believe, right from the start.
We knew really early on that we wanted to have an evidence-based recovery, and that really meant collecting data and evidence so that our decision making was informed and not based on a guesswork or anecdote.
That allows everyone that's working in the space to focus on the need and not necessarily the noise. And it also allows decision makers on funding and policy, etc., to have the evidence base that they require to work through those machinery of government processes.
We established the Canterbury Wellbeing Index, which collects existing data from across government departments, mainly from the health sector, from the education sector, employment data, all sorts of things like that. And we supplemented that with the CERA Wellbeing Survey, which is held 6 monthly, and that collects data from people about how they are dealing with recovery. One of the learnings for us is it's essential to be able to compare your data with what's happening across the rest of the country. Politicians in particular want to know that there's something different happening in a recovery setting. And as well as a national comparable measure, what you really are looking for is pre-earthquake baseline in the disaster-affected area. So we know what's happened in Christchurch before the earthquakes, and we know how it compares with the rest of the country. As well as having nationally comparable data, it's also really important to have data that's sensitive to local needs. So with the CERA Wellbeing Survey, what we've done is collect data that really reflects where people are at in the recovery. And we change the questions in the survey a little bit each time to reflect the fact that recovery does change over time, that people's issues emerge and change over time. The benefit of working across a number of agencies has been that most of them already have data collections in place. Typically, government departments, in New Zealand anyway, will publish data at a national level, maybe some regional data, but what we needed was data that really applied only to the disaster recovery area.
I think one of the important advantages of doing this as a collaboration is that you can get people bringing different skills and experience to the table, different access to particular data sets and information, and by working together we can actually pull all of those resources and make the most of it. For example, we had people in the survey team who had really good experience as policy analysts, so they were great in terms of that process mapping and building those key relationships with stakeholders that we needed. We had people who had research experience who were able to look at things like the survey design methodology, the questionnaire design, and pull that together really quickly and provide advice and support. And then we had academics who were able to assist with peer review of our information, interpretation of results, funding relationships and the like. And it really required everyone working in together to be able to deliver the results quickly.
We also think a lot about our audience. So some people are very tuned into data, they can look at a graph and understand it immediately. Other people really find that hard. So we've looked at different ways to publish our data. We have developed infographics, which bring sort of, pictures and creativity into the data sets. And we also have something we call the spider web. With the spider, what we do is we collect pre-earthquake baseline data, which creates the inner core of the spider web. What we then do is we have spokes that come in and out of the spider, and it shows whether trends have been improving or getting worse since the pre-earthquake period. It's so important to be an honest broker with the data, to present it neutrally. What we try and do is present both sides, the positives and the negatives, and I think that's quite a challenge in a recovery setting because you'll have some people that really want to hear the positive story and other people who really only want to hear the negative story. So when we present our data to the Minister, to other government departments, to agencies, to NGOs, it's really helpful if there are people in those sectors who already understand the data and the importance of it, and they can help us to spread the word about what the evidence base is saying and also to increase the reputational value of the data set that we've created. One of the things that we have been really focused on with our data collection is determining which population groups are experiencing the slowest recovery. And that evidence base has been crucial because people make a lot of assumptions about who is really having a difficult time. And often you hear that the elderly are, and in the evidence base that we've collected, they're not showing up so much as having difficulties. I suspect that's probably because they've had a lot more experience and context in their lives. Instead, what we've found are some really unexpected groups. So people aged 35 to 49 years were really struggling for the first 2 or 3 years of the response and recovery phase. And we think that's about the fact they had a lot of responsibilities for children, workplaces, they probably had a house that was damaged, those sorts of things. If we didn't have the evidence base to show that, we wouldn't have known that. I think looking back, having invested in a monitoring approach really early on has paid off. What it's allowed us to do is identify issues early and develop ways of addressing those with our partner agencies. It's also helped us work out which population groups really needed extra supports through the recovery, and it's given us the evidence base to justify making those decisions.